The possible causes of male infertility are numerous. It can be divided into congenital abnormalities, meaning that, for example, a man can be born with a testicle which is fairly high up and may require surgery to correct it. Or it can be caused by, for example, infection, and that can cause a swelling in the testicle, and classically viral infections such as mumps can cause infertility. Other causes can include anything that increases the temperature of the scrotum. So, for example, very tight-fitting underwear is not helpful, or if you have dilated veins around the testicle called a varicocele, that can cause infertility. There's general other causes such as issues with the hormones or the endocrine system, where sometimes some men may have a low testosterone, which can result in infertility. There are other more rarer causes where there's an underlying genetic abnormality such as Klinefelter's that can contribute. Other things can include, for example, patients may have had previous malignancies, they may have required chemotherapy or radiotherapy in the past, and that can affect fertility too. The other causes can include immunological causes. For example, you can have anti-sperm antibodies which can affect the sperm. And sometimes, unfortunately, there is no cause, and that's known as idiopathic. And that means that we've not been able to find a cause, and unfortunately that can be in a significant proportion of patients. Male infertility is predominantly tested by a semen analysis, and that's to look at the volume of semen, the quality in terms of the number of sperm available, the way it looks, the morphology, and in terms of motility, meaning the way it swims. That tends to be a very important test in terms of male infertility. Other additional tests can include hormone tests, which look at your luteinizing hormone or follicular stimulating hormone, as well as testosterone, to see how well the testicle itself is producing the sperm. The results normally take between 1 to 2 weeks, depending on the particular medical establishment, to obtain the full set of results. Unfortunately, in a proportion of patients, we are unable to explain why they have infertility, and this is known as idiopathic, and that unfortunately can affect up to 30 to 40% of patients. Unfortunately, it means we are not able to give the patient the reason, but instead we then need to work out how best to help them moving forward. Okay, so in terms of once you find the results, and unfortunately there's a degree of infertility, what we try and do is to determine the type of infertility. In terms of the sperm count, that might be reduced or maybe a small volume, and that's a common problem, and that can normally be tackled by lifestyle interventions such as losing weight, stopping smoking, or reducing your alcohol intake. A second type of infertility, which can be more difficult to deal with, is having no sperm, and that's known as azoospermia. There can be two causes for this. One can be due to a blockage, and that's known as obstructive azoospermia, and non-obstructive azoospermia. With that, you have to determine whether it's obstructed or not obstructed, and there is a method in which you can extract the sperm either through aspiration or actually through making a small incision in the testicle to obtain the sperm. There are occasions where patients may require a further, more complicated procedure called microsurgical testicular sperm extraction, which can find sperm in patients where previous efforts have been found to be negative. Just because you've been told that the semen analysis is negative, that doesn't mean that we can't still find sperm available for fertilization.